Hello, everyone. This is Kwong Dang. Many of you know me just as Q. And I am very excited to be presenting today on the Healthy Food at School webinar. Just a quick reminder, in addition to the chat functions that are available, we're going to be taking questions at different points today and at the end. In addition to any chat questions that you have there, I also wanted to let people know that today's PowerPoint, the resources that we talk about in today's presentation, as well as the recording, will be available within a week or so. So in terms of making sure that you're getting down all the links or scribbling everything down, you will have an opportunity to download all that within the week or so. So I wanted to start by just giving a little bit of background on Change Lab Solutions. We've had the opportunity to work with many of you before. We are mostly lawyers and planners, and we are really focused on working with state and local leaders to use law and policy to make communities healthier. That being said, what we do is not legal advice, and it is not also neither is it lobbying for any specific legislation. From Change Lab Solutions today, you have me, and you also have our marketing and school competitive food expert, Sabrina Adler, and we'll be hearing from her throughout today's webinar. I'm also really pleased to have Stephanie Bianco-Cimaral here from the Center for Nutrition and Activity Promotion at Chico State. Stephanie is a registered dietitian and an associate professor in the Department of Nutrition and Food Sciences and the assistant director at the Center for Nutrition and Activity Promotion. Her area of expertise is in community nutrition management and food safety. She's had a lot of experience working in the Chico school systems, and she's going to be talking about many of those lessons learned and successes later on today. So welcome, Sabrina and Stephanie.
Thanks, Q. Thank you.
Today's agenda is pretty basic. We're going to do a quick introduction to talk a little bit about schools in general and why this is so important. We're going to talk about the Healthy Hunger-Free Kids Act of 2010. That's the federal law that's really in play for healthy school foods. But we're going to talk not just about that, we're going to talk about going beyond the Healthy Hunger-Free Kids Act, because here in California there's a rich history of stronger policies in terms of healthy foods, and we want to talk about what those opportunities are. Then we're going to hear a presentation called Snap Ed Money for Impact in Chico, and that's from Stephanie, and that's excellent. That's going to be really interesting, a lot of real-life experiences that a lot of you have asked for. So we're really excited to have that. And then we're going to walk through 4 or 5 policy, systems, and environmental options in the school setting that build on all this. So to get us kick-started today, we're going to go to a poll question for you all to answer. And it's a really simple question. It's a simple yes or no question. The question is, are you currently working on making school food options healthier? So we'll just have a minute now to let folks answer that question. So again, the question is, are you currently working on making school food options healthier? And this is very a very broad question. All right, great. So I think we can safely give that just another couple of seconds. Okay, great. So it looks like the majority of folks, are currently working on making school food options healthier. Over 3/4 of you are currently working on that. So, I think that's an important starting off point to know that we have a lot of experience working on this call today, and there are a lot of people who are looking to work with schools for the first time. When we talk about the importance of working in schools, I think maybe building on the poll, I want to kind of skip to kind of the 4th and 5th bullets here on this slide. It's really important to work with schools because schools really have been the leaders in improving healthy food options in environments through policy, systems, and environments. And that's something that schools have been doing, and it sounds like a lot of people on this webinar have already been doing. Taking a step back in terms of the importance of focusing on schools, we know that schools are an important part of civic and community life for children and for parents. Research confirms that there's a clear connection between health, learning, and attendance. We know that healthy children are more successful in school, miss fewer days of school, are more attentive and well-behaved at school, and are more likely to graduate from high school and go to college. We also know that in at-risk communities, health disparities contribute to the achievement gap, and that these are all things that this network has been working to improve on, and schools are an important element of this. In terms of the key network opportunities that are already existing in schools, there are a number of really amazing programs that are already, and campaigns and initiatives that are already in place that folks on this call can tap into as part of being a part of the Network for Healthier California. I want to highlight 6 or 7 of these, and of course we'll be providing the links to these resources as well. Children's Power Play is a public health initiative that's led by the California Department of Public Health. And the purpose of Power Play is to motivate and empower 9 to 11-year-olds in California to eat 3 to 5 cups of fruits and vegetables and get 60 minutes of physical activity every day. So at the core of this are these kits for 4th and 5th graders, which feature fruits and vegetables and physical activity into the lessons and activities, as well as learning how to set goals and spread the word. And there's also a lot of links from this Power Play initiative to some of the other opportunities here. For example, Harvest of the Month. Harvest of the Month provides materials and resources to support healthy food choices through increased access and consumption of fruits and vegetables, as well as to encourage daily physical activity. The unique approach that it takes is to support core curricular areas through exploration and study. Harvest of the Month presents a strategic opportunity to bring together classroom, cafeteria, home and community, all to promote the common goals of healthier habits for students, especially in low-resource schools. The 4 key monthly elements of Harvest of the Month are a newsletter for educators, newsletter for families, and then templates and posters around menus and press releases. Team California for Healthy Kids was initiated by State Superintendent Torlakson, and the purpose of Team California is to promote healthy eating and physical activity throughout the day in schools, as well as in before and after school agency, early childhood programs, and communities. The focus of that campaign is to make healthy choices the easy choice, and it does this by increasing physical activity, especially moderate to vigorous physical activity, throughout the day and in schools and communities, as well as increasing access to water and fresh foods and things like salad bars. Interested folks who want to take the Team California pledge can also get resources on how to help create these healthier physical activity, fresh food, and water access environments in California. Nourish, that's an educational initiative designed to open a meaningful conversation about food and sustainability. And they work in both schools and communities, but they have specific resources for schools as well. Nourish combines curriculum and television spots from PBS, other web content, short films, seminars for teachers and for young people, all around these central issues of food, community, and sustainability. The Health Core is a curriculum that's composed of a number of different sections, but includes nutrition and fitness. The curriculum is aimed at educating students, but also providing a holistic view of the role health plays in their lives. The curriculum is taught in a number of different ways. They have different labs and classrooms and programs for the lunchroom and after-school clubs that integrate all of their materials into a comprehensive health education system. California Farm to School are programs that connect schools with local farms with the objectives of serving healthy meals in school cafeterias, improving student nutrition, providing health and nutrition education opportunities that are aimed at lasting a lifetime, as well as supporting California farmers. The California Farm to School site offers opportunities for folks to learn more about farm to school, find schools and farmers in their area to connect with, and also resources compiled around implementing local sourcing at the schools, developing garden and nutrition lessons, identifying funding resources, and learning about statewide policies. And then the last program and initiative here I wanted to highlight is Let's Move Schools. Let's Move Schools is an offshoot of, Let's Move out of the White House, out of the First Lady's initiative. But they have kind of these specific Let's Move campaigns, like Let's Move California or Let's Move Cities and Towns. Let's Move also works with the food industry. Let's Move Schools is focused more on physical activity, which is not the focus of today's webinar. We're looking more at healthy food. But they do go hand in hand, and it's a good resource for looking at an initiative that is using policy systems and environments to changes to activate grants and to provide technical assistance and training as well as resources. So those are a number of the different network opportunities that are available to folks on this call who want to get involved and want to promote promote healthier food at schools. And again, these web links will be available to you when you get provided with a recording of today's webinar. So with that, I'd like to move on from these network opportunities to going to what the state of the law is right now on healthy food at schools. And that conversation starts with the Healthy and Hunger-Free Kids Act of 2010. 2010 is when the Healthy Hunger-Free Kids Act was passed at the federal level, but rules on the specific components of the Healthy Hunger-Free Kids Act, school meals, competitive foods, wellness policies, the specific rules about that are coming out after 2010, have been coming out almost on a yearly basis. School meals was really dealt with in 2011, 2010, 2011, and even into 2012. With school meals, the Healthy Hunger-Free Kids Act improved nutrition standards for school meals and also represented the first substantial increase in reimbursement for meals that qualify under the new standards in decades. This, again, played out mostly in 2011. And what is happening now is that states like California are helping local school districts and schools meet the new standards and qualify for increased reimbursements. Some of the challenges that have really presented themselves are how to best build support for implementation of new school meal standards and some of the complications around whether kids are eating meals, getting enough calories, and plate waste. We're really lucky to have Stephanie here today, who's going to walk us through some of the important work that they've done in Chico schools, and that'll really show some of the progress that's been made in this area. In competitive food, the Healthy Hunger-Free Kids Act took bold steps in setting standards for food outside of the school meals for the first time, and Sabrina will be talking about this more in detail after I get a chance to give an overview of state laws and wellness policies and things like that. The wellness policy rules under the Healthy Hunger-Free Kids Act are not out yet. They should be out later this year. But the law has made it clear that they want more people involved in the wellness process and on the wellness teams. And they want more people not to be involved not just in the development and implementation of wellness policies, but also in the reporting and periodic assessment of wellness policies. There's been a lot of questions since wellness policies started coming around in 2004 and afterwards about how they're being implemented and enforced and reviewed. And some of these new rules hopefully will come out, will give more guidance on how schools can put some of that stronger language into the wellness policies. Water is not on this slide, but that's something else that the Healthy Hunger-Free Kids Act now requires water to be served at lunches, and the guidance also suggests for water to be available at breakfast. There are other things that we can do, and we'll talk about that in the policy systems and environmental section of the webinar. In terms of state laws here in California, it's important to know that California state laws on these issues are not preempted by the Healthy Hunger Free Kids Act. What I mean by that is that the Healthy Hunger Free Kids Act clearly states that schools can do more. California schools can be more restrictive in just about every arena that's covered by the Federal Act. California's existing laws are already more restrictive in some ways, and the existing laws that are more restrictive can continue to stand, and California can pass more laws if it wants to that promote student health and healthy eating more so. Furthermore, the California Department of Education has a role in issuing guidance on these components. For example, we've had a lot of leadership from Superintendent Torkson on schools and about updating wellness policies. One great quote from the superintendent that I'd like to read is he says, "Nothing is more important than the health of our children. In my time as a teacher, coach, and policymaker, I have been committed to fighting for an education system that serves the whole child, not just their minds, but also their mental and physical wellness." So just in terms of the Healthy Hunger Free Kids Act, I think the main takeaway here is that working together at the local level, it's important to understand the federal rules. It's important to understand that California rules can make the federal rules stronger. It's important to understand the state guidance, but it's also important to understand the opportunities at the local level where you can make healthier food options stronger still. And in order to look at a particular example of this, I'm going to turn it over to Sabrina, who will talk about competitive foods in more detail.
Thank you, Q. So as Q mentioned, the Healthy Hunger Free Kids Act required the USDA to issue regulations that would govern the nutritional content of competitive foods, which are all the foods sold on kindergarten through 12th grade campuses that aren't part of the regular school meal program, so the school breakfast and school lunch. And USDA has been working on this rule, and on June 27th, just this summer, they issued an interim final rule, which means it's almost finalized. And that rule in its final form is going to take effect beginning next school year, so in the 2014-15 school year. It would take a really long time to go into the details of every requirement of this rule and all the nutritional requirements, and you can access the rule itself. There's a link there on the bottom of the slide, and everything is spelled out on USDA's website. But what I want to emphasize is, again, what Q said, which is that this rule serves as a floor, which means that both states, and that would take action on the state level, or local school districts can go above and beyond that federal rule and put into place nutrition standards that are even stricter than the federal rule. So as you probably know, the state of California and some districts in California already had competitive food standards in place, and those standards are going to remain in effect for this upcoming 2013-14 school year. But starting in 2014-15, California schools and districts will have to comply with the federal regulations. But as Q said, when state regulations or local district policies are stricter than those federal requirements, schools will still have to follow those stricter requirements. So it's going to be a little bit of a task to parse out which pieces of the regulations are stricter for which food items. But to give you a few examples of areas that we already know that school districts might be able to go further than the state and federal regulations, I'm going to talk about three different things. So first, both the state and the federal regulations will allow flavored non-fat milk as long as there are fewer than 28 grams of sugar. That's the current California regulation, the 28 grams of sugar, and the federal reg just says that non-fat milk can be flavored. But a local school district could choose to enact a policy that would prohibit the sale of any flavored milk, even non-fat milk. A second example would be that while the federal regulations don't permit added caffeine in elementary and middle schools, there aren't federal or state standards right now governing the sale of energy drinks in high schools. So a local district might want to adopt a policy that would limit the sale of energy drinks in high school. A third example has to do with fundraisers. So the new federal regulations are going to allow exceptions to these rules for fundraisers where food items are sold to raise money. But they're only going to allow that if CDE specifies a certain number of allowable fundraisers per year. So we don't know yet whether CDE is going to specify that number. If they don't specify a number, then there is no exception for fundraisers. But even if they do specify a number, that local school districts can enact even stricter rules. So they could say that there can be fewer fundraisers, or that all foods, even at all fundraisers, have to comply with the standards. Local districts could also enact rules for after-school fundraisers, like concessions at sports events, and those aren't covered by the federal rules right now. Or they could enact rules for celebrations or events where food is provided free of charge, since the federal rules and state rules just apply to foods that are sold on campus. And then the last thing I want to say about competitive foods is that because this is all new and happening kind of as we speak, we don't know if CDE is going to issue guidance on this. They very well may do so. They might also choose to update the state regulations so they either match or go beyond the federal regulations. But these changes might not happen right away. So I would say that everyone should keep an eye out for any CDE action on this subject. And with that, I will turn it over back to Q.
Great. Thanks, Sabrina. So our next poll question for you all is related to competitive foods. It's in California, stronger competitive food rules already prohibit many sugar-sweetened beverages. So this is a question for you. Do you favor policies that would prohibit sports drinks from high schools? So again, that's, do you favor policies that would prohibit sports drinks from high schools? And okay, I'll let the results keep coming in, but I'm going to go ahead and skip to the results here, and they can shift if people keep responding. But it seems like here again, the overwhelming majority of folks, 84%, do favor prohibiting sports drinks from high schools. One thing I do want to point out is that this is probably not the most scientific cross-section of the public on this call. And we know that sports drinks and electrolyte replacement drinks is a very controversial area in many schools and with athletic programs and things like that. So it's not, I think, as cut and dry as this might indicate. So we're going to hear from Stephanie next, but before we go to Stephanie, I just wanted to address any questions that folks had. One question that has come in that I wanted to address is the Nourish curriculum an approved resource by CDPH and by the Board of Education? I'm not sure about the Board of Education. I'm not sure about the Board of Education's process for approving these kinds of third-party curriculums. It is an approved resource of the California Department of Public Health, and several school districts, many school districts, use the Nourish curriculum and partner with Nourish as a partner in California, and that curriculum is in fact free to K through 12 educators in California. So if that Board of Education question, it's the question about whether the Board of Education looks at it is something that we may look into. I am getting some information in from another chat participant that says that Nourish is only partly allowable as a resource. So that may be something. At the end of the webinar, we'll have some information on your network contacts. The network contacts for this webinar are Betty Sun and Lisa Tadlock. So if you want to know if the Nourish curriculum or any of the other resources that were highlighted are allowable, check with your program manager, and you already either have that information or you can get that information from Lisa or Betty, whose contact information will also be provided at the end of this webinar. So I'm going to move us along to Stephanie's presentation on her lessons learned from using SNAP-Ed money for impact there in Chico. Stephanie?
Yes. Hello, everyone. Thank you, Q. I'm Stephanie Bianco-Cimarral, and as he mentioned, I'm the professor at CSU Chico and the assistant director at the Center for Nutrition and Activity Promotion. Our CSU Chico Center has received SNAP-Ed dollars for over 11 years, and we have been given access to school sites and community organizations in 17 Northern California counties. We have provided nutrition education interventions over the past decade and know what activities make a difference and which activities have proved futile. We have also recognized with all of the work to build school and community relationships and the effort to engage children and their families, we have much more work to do. If you look at the following two images on this slide, first you can see a school lunch tray with French fries and what appears to be some cheesy red bread mass, perhaps pizza or chili dog, I'm not quite sure. But it is a tray that can be provided to all children every day of the week, even with our new school meal legislation. Remember, French fries and tomato paste are considered vegetables, and that is something we need to know as we're going into the schools. On the other image, as you can see, regardless of what positive changes are made with school meals or school district food policy, if the campus is open for lunch, it's considered an open campus, a child could consume a Slurpee or fried chimichanga every day for lunch, and essentially that is the reality that we're facing. We have more bad news. With all the effort and dollars spent, obesity rates continue to rise with our low-income K-12 children and adults, which does feel quite depressing. For all the money and effort that we're doing, we may feel, well, has our work meant anything? And how can this be? Just 12 days ago, the Institute of Medicine published a report titled U.S. Obesity Prevention Efforts Fall Short. But rather than just criticizing public health efforts, they emphasized the need to evaluate what efforts work and what efforts do not. I appreciated this report for many reasons, but the primary reason is because when efforts do work on one level, such as actual selection and consumption of healthier foods in schools, we need to know why the obesity rates continue to climb. Do more fruits and vegetables during school lunch matter if families are consuming highly processed fast food for breakfast and dinner every day? But we also have some good news. It appears to be a glimmer of hope for us. The Centers for Disease Control and Prevention published a report 8 days ago that indicated small drops in obesity for low-income preschoolers, and this was in 18 states. It should be noted that 10 states were excluded because data collection methods differed between the time periods. What I didn't like about this report was that it speculated on why the drop in obesity rates occurred. They mentioned women, infants, and children and the new changes with the WIC program, and they even mentioned the Let's Move Child Care campaign as possibly the reasons why. And I would absolutely like to think that these efforts were the reason for the decline, but the fact is we don't know. Without science-based evidence, we cannot guarantee that these rates will continue to decline or even plateau. As I mentioned, our center at CSU Chico has received SNAP-Ed funding as well as other obesity prevention funding for over 11 years. We have used our dollars wisely and altered our interventions each year and have very good insight on the efforts that influence not only attitude about healthy foods and beverages, but actual observed behavior change. We recognize that knowledge-based nutrition education alone in schools cannot stand up to the family fast food dinners and the neighborhood food deserts. Our center recognizes that local policy changes will not occur without engaging the children and their families first. They must want healthy food and know how to make healthy food before they can influence their teachers, administrators, community leaders, and before changes emerge. The engagement, the child and family engagement is key. So how does our center engage children and their families? Our SNAP-Ed dollars helped us provide 35,000 fruit and vegetable tastings to low-income K-12 children every month. We engage these children with Harvest of the Month tastings. We also use images of meals using the Harvest of the Month information. We have information about the local farmer who produced that same Harvest of the Month. We call that Farmer of the Month. And even videos of the farmer who they may have even seen at their local farmers market. We also use SNAP-Ed dollars to provide mobile kitchen carts and cooking demonstrations in the classroom to further expose the children and engage them with sensory and skill-based activities, not to mention that our activities help teachers meet some math and science educational standards. On a side note, our other USDA AFRI dollars also provided 600 children and their families in southern Butte County with home cooking kits to support these Harvest of the Month tastings, cooking demonstrations, and Farmer of the Month activities. These dollars could be used to buy food to duplicate the same recipes in their home and actually get their parents and caregivers cooking with them. Although this activity was not SNAP-Ed funded, study results indicated that children and parents were engaged as hypothesized. These are just some of the SNAP interventions, our center interventions. You can see examples here of our student staff, who's actually a graduate student, demonstrating the veggie roll-up that showcased our Harvest of the Month peppers. So you can see how actively engaged the children are and the self-efficacy that is imparted. But how do we know that these activities really work? Although we have many evaluations and publications under our belt that indicate an improvement with the child's attitude and self-reported healthy behaviors, we wanted to determine if there was actual observed behavior change. Therefore, in 2011 and 12, we conducted a plate waste study using a unique digital camera method to determine if our interventions were making a difference. This study came about because our local food service director told us that she was buying far more fruits and vegetables in the district's low-income schools where we were working than in the higher-income school sites that are not eligible for SNAP-Ed funding. Her required production records at the school sites indicated that her statements were true, and we verified these documents by actually taking pictures of every child's cafeteria tray before and after consumption. As you can see by the images here, we were able to determine what a child selected using the offer versus serve model and what they actually consumed. We observed 3 intervention schools, what we call our Harvest of the Month schools, and 2 control schools. We observed these 5 schools for 4 consecutive days before the intervention period and for 4 days after. Here is an example image of one of our trained student researchers. The child will essentially just place the tray down and the researcher photographs the tray using digital cameras. The pre and post photos are uploaded and quantified into our software systems before they're uploaded and quantified into our software systems before and after the intervention period. And after many tedious hours and weeks worth of data entry and analysis, you can see the results on the slide, where our Harvest of the Month students select significantly greater number of servings of fruits and vegetables than the control students. Our first graders who didn't have any of the harvest of the month influence in previous years significantly increased their fruit and vegetable consumption from the first to last observation. And harvest of the month students are 3.7 times more likely than control students to consume more vegetables following the intervention. Okay, so we determined that our SNAP Ed efforts did have an impact, but can we impact behavior in the schools without the Harvest of the Month cooking demonstrations? Researchers at Cornell and elsewhere have completed work that indicates that positive healthy behavior changes can occur with very simple and relatively inexpensive environmental changes. Drs. Wansink and Just at Cornell have what's known as the Healthy School Lunchroom program and have made minor cafeteria changes that will significantly impact behavior change. And in this article that you see here in the image, found that just by having photos of vegetables on the tray, children selected and consumed more of them. So this is pretty impressive, and it seems so easy and cost effective, and we wanted to know if something similar would happen in Chico. After further investigation, we began to design our own study using these methods that are typical in the field of behavioral economics. Essentially, behavioral economics, or BE, is the influence, I'm sorry, my screen just went down, I'm sorry. Essentially, behavioral economics, or BE, is the influence on consumer behavior at the point of selection. For example, what influences you or me to buy a food at the grocery store or a beverage at the coffee shop? Well, marketing experts know that the greatest influences on food and beverage selection or purchasing is 1, the cost, 2, how convenient it is, or in other words, what is right there in front of me. We also call that the default option. 3, the taste. For example, how much fat, salt, and sugar can I get? 4, what societal pressures are on me to choose that item? Or lastly, is it just in front of me and I think I need it on an impulse without rational thought? Based on the previous and current research out there, we decided to try out behavioral economics. Although chocolate and white milk are both nutrient-dense foods, chocolate milk is considered less superior than white because it has a little more added sugar and the chocolate flavor kids love. And since our elementary schools don't offer donuts and candy for lunch, we chose milk as our first item to test using behavioral economics methods. As you can see from the images, the first strategy was 1, to make it more difficult to get chocolate milk, and 2, to make the white milk more prominent. For the most part, our study was very enlightening. When we focused on convenience and made the chocolate milk more difficult to get, we saw a significant difference in how much chocolate milk was selected and therefore consumed. But did the kids not ask because they didn't see the sign? Did they think the school ran out of chocolate milk? Were they embarrassed to ask? We could speculate for days, but regardless, the children took less because it was not convenient for them. Our second strategy, to just have more white milk, did not significantly increase white milk selection. If the child liked chocolate milk more and saw it, they still selected it, regardless that there was more white milk. We don't have time to go into the implications of this, but it does make you see that removing the item is the most inconvenient and effective strategy out of the two used. But what about fruits and veggies? We want the children to select and consume more fruits and veggies. So what simple cafeteria changes would work? There are 3 primary methods we could use: those using signage, those using verbal nudges, and those focused on the display of food. And I'm going to go through each one of those so you can get an idea of what is possible. Here are some examples of signage. Here, using colorful, attractive signage, things such as fresh fruits and veggies today or new and improved. We know those strategies do work. Marketers use it all the time. Posting menus before the students actually are in line, giving them the idea of selecting these foods while they're waiting. renaming items on the garden bar, something as simple as calling the items super strawberries, and even using photographs on tray compartments like they did in the study I mentioned previously. The other primary strategy is verbal nudges. These could be things such as suggestive selling, saying, what vegetable would you like versus would you like a veggie, or here are your carrots versus do you want carrots. Those simple suggestions could make a difference. Prompting, please take your carrots or don't forget your carrots, rather than just having the children walk by the line and not taking anything at all. Bragging or even praising bragging about the foods that you're offering, and even praising the children when they actually take those items are also methods. Food placement is another strategy of behavioral economics. Here's some examples that you could choose from. Just placing the fruits and vegetables at multiple locations in the line could have an influence. Making the healthier items the first in the line and moving the less healthy entrees further out of reach, again making them less convenient. Placement of less preferred items next to a more preferred item. So example, beans next to sugar peas may have an impact. Identifying negative trigger foods. So just the removal of certain foods that may initiate consumption or more consumption of another. Like if they were to consume French fries or ranch dressing, it may stimulate the need for them to consume more or to suppress their satiety. Reducing the number of choices or irrelevant alternatives from the lunch line could also be a method that we could use. Here is a slide with 2 examples of what we've used in our school sites and in our study. All of these behavioral economic strategies could be used, but we selected signage, specifically attractive and fun images with reminders like the tangle character above, and using a sign or poster that had photographs of salad bar items on tray compartments. So for example, the kids could see the exact items that were in the salad bar at our sites and where they should be placed on their trays. So it was kind of like a puzzle for the children. For this BE study, or behavioral economic study, we had 3 observation periods of 5 consecutive days each at 4 schools. There were 3 intervention schools and 1 control. The first intervention site received the signage mentioned on the previous slide. The second also received an environmental food placement change. The food placement changes included the addition of more fruits and vegetables than usual and the addition of vinaigrette along with the ranch dressing that was normally offered with the salad bar. As in many school districts, no other dressings besides ranch are usually offered. The third intervention school received the signage plus our Harvest of the Month activities. We used the same digital camera plate waste methodology pre to post intervention periods, but unfortunately we could not observe the control site during the second observation period. Here is a recap of the schools used in this study, so you can see behavioral economic signage and behavioral economic environmental change group, the site that was behavioral economic signage and Harvest of the Month, and then our control site. After many weeks of data entry and analysis, our center determined that signage alone was not as effective as signage with food display or as signage in combination with our Harvest of the Month nutrition education efforts. In fact, multiple efforts were needed to increase vegetable and fruit selection. So in summary, it's clear that SNAP Ed dollars can be used to positively affect change in our schools. However, as I have reiterated throughout the presentation, it's vital to engage children and their families in skill-based nutrition education activities before any local, state, and federal policies can be changed. Remember, regardless of what impact we have in schools, there will be no change in the obesity rates if the non-school environment doesn't support healthful choices. And if you're interested in more about what I have just discussed, please feel free to contact me or other staff at the Center for Nutrition and Activity Promotion at CSU Chico. Thank you so much for letting me participate in the webinar, and please let me know if you have any questions.
Great. Thanks, Stephanie. That was really, really interesting. A couple of questions came in. One I think you may have answered at the end where you talked about some of the controls, but I'll let you answer it as being the social scientist here. A question came in, did you control for the Hawthorne effect or similar biases with the students when conducting the plate waste study?
In terms of having in terms of having them know we are there and knowing that we're looking at this, our students were dressed in the same types of clothing as the other staff. It was mentioned that some of the kids could have selected the fruits and vegetables because we were there. They did think that that might have something to do with it, but we did have a follow-up period where no one was there, and as far as I know, the production record still indicated that there was continued fruit and vegetable selection.
Great, thanks. And I think in reference to the Hawthorne effect, that question is about the fact that study results can be skewed by the fact that there is someone just observing. Is that correct?
Correct.
Okay, great. Another question, in terms of how you did the photos and the procedures, are those things that people can contact you about with more, for more details about the studies and how you did them?
Absolutely, absolutely. We have all of the methods detailed out, and we're in the process of actually writing a manuscript and publishing our findings. So we do have everything written so it can be duplicated.
Great. And then one other question, did you include student consumption changes as part of your study?
Did we include student consumption? Well, the one that we just currently did, if you'll excuse me, it was due just in August 1st. And I don't have all that information, but I know we do have it. We're still in the midst of a lot of data and a lot of analysis, and those haven't all come out, but we do have those. We will have those results shortly. Great.
And then one last question for you, Stephanie, is can you mention some of the items that are part of the home cooking kits that you mentioned early on in your presentation?
Sure. We did a great job in terms of using our funds, our non-SNAP Ed dollars wisely. I think we spent about $7 on each cooking kit, home cooking kit, and it included a backpack. We had a cutting board, dry and wet measuring cups. We had apron, and then again, that went home at the beginning of the school year, and then with each demonstration in the classroom, we had the food and the recipes that they could then take home.
Great.
Hopefully
that
explains it.
Great. Well, thank you, Stephanie, for your presentation. I know Stephanie is calling in from the road, so she may have to drop off at some point. So I'm glad we were able to answer these questions and we were able to get through your really, really informative presentation. It really sets the context really well for the next section of the webinar, which is looking now at policy, systems, and environment. Because what I take from what Stephanie says, I mean, all this is really interesting, and what it points to is that we have to talk about changing the environment as well, not just about individual behavior or education. And that's something that schools have done. And so we're going to talk through a number of different policy systems and environment options. The first one I want to talk about is healthy vending. And I want to talk about this for a number of different reasons. One is a lot of PSE work has already been done here in California with regards to healthy vending. California has been enforcing nutrition standards for competitive food since at least 2007, and a recent study in the Archives of Pediatrics and Adolescent Medicine found that CDC data now showed that eating habits of California high school students, they consume fewer calories on the order of about 160 calories a day and less fat and less sugar than students in the 14 other states that were studied. What remains in the healthy vending arena is that sports drinks and flavored milk can still currently be sold in many parts of California, in many schools in California, most schools in California. And so that's something that that's a policy systems and environmental change opportunity that's out there. School districts in San Francisco, Oakland, and Lemon Grove have adopted stronger restrictions to stop selling sports drinks to students. San Francisco and Oakland has done this in their wellness policies, and Lemon Grove anticipates adding this to their wellness policy in the future. There are still some loopholes that are out there for vending machines and fundraisers and before and after schools that aren't really covered in the federal rules yet, aren't covered in the current California rules. But local school districts can go further. Oakland, for example, has gone further in its restrictions and does not allow sugar-sweetened beverages, and that includes these, these kind of outliers of flavored milk and sports drinks. They do not allow them to be sold at any time in schools, including in vending machines or for student fundraisers, and even in the half hours before and after schools. And those are certain areas of healthy vending. There are certain, loopholes isn't quite the right word, but there are gaps that are still out there that are opportunities for getting healthier food and beverages in schools in terms of the healthy vending. Some of the resources that we have available here at Change Lab Solutions, we have two that are specific to schools. One is a fact sheet developing a healthy beverage vending agreement, and that's a fact sheet that is aimed at the audiences that many of the folks on this call may be working with. It really spells out really simply what the advantages are of such an agreement and what some of the steps are for doing that. And then the actual policy itself is in this district policy document, and both those things are available on our website, and you'll have the links when you get a copy of this recording. We also have a more general, a broader document about vending that's really geared towards municipalities, not schools, but may have many of the applicable best practices and lessons learned and steps and ways to frame healthy vending that may be helpful to you as well. Another policy option is increasing access to water. This is really important in the school setting. Water safety, availability, and appeal are all challenges that schools throughout California face. The Healthy Hunger-Free Kids Act and California law both require water to be available at mealtimes, but what about throughout the school day? What about especially at times or places where kids are most active, most physically active in gym or in other activities? Do they have access to clean, safe, free water at those times of the day in the school, throughout the school day? We have a couple of resources here at Change Lab. There is our model wellness policy language for water access in schools. This has sample language, examples, case studies, all about getting safe water into schools. And then we also have a companion piece for California with some of the studies and some of the case studies around schools that have actually done this and the approaches that they've taken. So those are both available. The lens that these documents take, the kind of policy lever that is being used, is the wellness policy, and that's the next policy option that I wanted to highlight. Wellness policies are another area where schools have made great progress since the original child nutrition authorization in 2004. Many school districts follow a couple of different statewide or national models for their wellness policies, either the California School Board Associations or the NANA, that's the Nutrition and Activity Alliance models for wellness policies. And so many school districts already have this, and many school districts are in the process of reviewing and updating their school wellness policies, but they're also waiting for the federal rules to come out, which again we expect to happen this year. Now is the time for schools to be reviewing and updating and making sure that the issues that they want to get covered by wellness policies make it into the revisions as they start happening in the coming school years. Some schools have already taken a really broad approach to wellness policies and are applying almost a coordinated school health lens. We know of this here in Oakland. We know of this in the Central Valley, and where wellness policies are looking at other issues like health education, safety, and safe and healthy schools, addressing issues like gun violence, student wellness services. And so there may be opportunities to look at policies and systems and environmental changes around things like fundraisers or school events, things that are not quite covered as robustly as some advocates had hoped for in the federal rules. And we don't know yet exactly what the California rules will look like. Another area that I want to get to is prohibiting advertising in schools. That's another policy option. I'm going to turn it over to Sabrina to talk more about that.
Thanks, Q. So just to quickly set the stage, the food industry spends about $149 million every year advertising in schools, which represents about 8.3% of the total amount spent on marketing to kids. And it takes a lot of forms. There might be branded food sales, direct advertising on school property or school buses, scoreboards, exclusive agreements. They might sponsor programs like PE programs or technology programs. They might give away coupons, etc. And there are several things that can be done policy-wise to address this issue. First, and it's not on the slide, but you could just ban all advertising on campus, and there are several school districts that have done that. San Francisco in California is one. Seattle, which is not in California, obviously, but they also have a policy that prohibits certain forms of advertising or commercialism on campus. But the other options, specifically with respect to food, are to ban all food and beverage advertising or to just ban marketing for foods and beverages that can't be sold on campus. So if you're going to do the latter, which is the foods that can't be sold on campus, the standards should really mirror whatever competitive food standards are in place for that district. So if it's the federal or state or local standards, like I discussed earlier. There is a concern about losing money, but there have been several reports and studies showing that that's not really as much of a concern as people might think that it is. In particular, one study showed that 87% of schools from a national study reported that they actually wouldn't need to reduce programs or activities if advertising from companies that sell foods of minimal nutritional value are sold on campus. So ChangeLab Solutions has a number of resources on this. Maine is the only state that has actually implemented a statewide ban on advertising in schools, and we have some materials on that, but we also have some model policies and model language for school policies based on both of those options I discussed, either banning certain advertising for all foods and beverages or for those foods and beverages not allowed to be sold on campus. So I'll turn it back to Q.
Thanks, Sabrina. One thing I wanted to question came in. I just wanted to clarify, and Sabrina, you didn't say this, but one thing that's really important to note in terms of the funding and allowable activities that you have is not if you're doing your if you're looking at policies around advertising, is that you're not allowed to disparage any specific brands as part of your activities. And if you look at the policies that Sabrina highlighted in our model policies, you will never see that in our work anyway, because that would be unconstitutional. Sabrina avoided a lot of the legal mumbo jumbo, but basically you couldn't say you can't drink this, but you can drink that. It's easier, and the kind of policies that she talked about either eliminating all food and drink marketing, or restricting the ones that you already are not allowing people to drink, that is constitutionally allowable, and that is perfectly consistent with your network guidelines as well. So I just wanted to give a quick reminder to folks. I just wanted to do a quick time check. We're right at 12 o'clock. One other question that I got about wellness policies, which I wanted to address with the whole group, is in addition to CSBA and NANA, are there other templates that are out there? The Rudd Center at Yale University is planning on putting out their wellness policy template. There are other, the different states have different templates. And so the California Department of Education itself may put out a template after the federal rules come out. And again, a lot of that we're waiting to see what federal rules come out. Let's see. I want to, for those of you who are able to stay on for a couple more minutes, in terms of healthy school food zones, we have some policies that are available here. If you want to look at broader options to look at the zone outside of the schools, Stephanie mentioned the issues that come up with open campuses. And even if you don't have an open campuses, there are issues around fast food restaurants around the schools and how that affects obesity and eating. And so we have other resources here and policy options that look at that if that's something that you're interested in. And with that, I just want to close out by going to remind you that of some of the links that are available and the resources that are available for the Network for a Healthy California, the website that's available, as well as your contact information for Betty and Lisa. We had some questions come up during today's call about what are allowable curriculum and resources and eligibility and some of the eligibility guidelines for some of the policy options, and your program manager is an excellent place to start with this. And with that, I think I will, let me do a quick check to see if there are any other questions that we can get to. I don't think that there are, I don't think there are any other questions that anyone has posed. So thank you all for your time today. Again, please look for a recording of today's webinar and a link to the resources and the PowerPoint within the coming week or so. And again, thank you very much.